If you have an L4, L5, or L5, S1 disc bulge and you have pain while you're sitting, I'm gonna show you a specific sequence that's gonna fix that. And it's your health, so you need to be in control. If you have an L4, L5, or an L5, S1 disc bulge, which looks like this, and you're getting pain when you're sitting, maybe at your desk, I'm gonna show you a specific sequence that's gonna fix that. But please pay attention because there are certain movements and stretches that will actually make this worse. The problem is not weak muscles or tight hamstrings, it's increased pressure in your disc when your nerves are already on high alert. So in this video, I'm gonna walk you through a specific sequence that unloads disc pressure, then helps to centralize the leg pain and calms the nerve so you can get your work done or do what you need to do. By the end of this video, you'll know which movements actually help these disc-related leg pain symptoms for you, which ones make it worse, and how to use those signals to sit longer with less flare-ups. Hey, I'm Dr. Paul Barnwell, a chiropractor in Katy, Texas. For more than 10 years, I've helped people get out of pain and return to the life they want without drugs and surgery. It's my mission to help people just like you to understand your body and build long-term health so you can live the quality of life that you were designed to have. If you're dealing with chronic pain, failed treatments, repeated flare-ups, or surgery that's been recommended, this channel's for you. I want you to know how to take control of your health and take responsibility for your health, because I'm tired of seeing pills and potions and lotions thrown at patients without knowing what's actually going on. Take 2 seconds, hit that subscribe button below. It's free for you. It gives me a nice dopamine hit, which encourages me to make more and better advice and videos for you. I upload a new video every week, so let's get to it. Okay, so before I get into the tips that are gonna help if you have an L4, L5, or L5, S1 disc bulge and you have pain while you're sitting, I wanna tell you what to be careful of or what not to do. I think it's important to understand what's actually happening with your disc and with your nerves so that it makes sense why you don't wanna do these things. So when we're taking a look at the spine, this is the back, this is the front. So the back is where you can feel. You can actually feel it if you touch your back. If you're having symptoms from a disc, it's because the disc is bulging backwards. Now it can be in the middle, it can be on the side. It depends on the case, but the problem there is that it's taking up space where these nerves come out. Now these spinal nerves, they go down your back, they go down your leg, and they coalesce and they become the sciatic nerve. Now, wherever that nerve goes is where you're gonna have those symptoms, and it's gonna make your hamstrings, it's gonna make your glutes hurt, and it's gonna make them tighten up because the body's guarding, it's trying to protect itself. So it may feel natural to try and get into a flexed position, so something like this, so that you can stretch your hamstrings, which I'll show you here. So if you're feeling that tightness that's in your leg and you're trying to stretch the hamstrings going forward, it's self-defeating because you may feel a little bit of tension relief in the hamstring, but as you're flexing that spine, you're pushing that disc further backwards. So you get temporary relief and then it's gonna feel worse afterwards. With everything that we're doing here, we wanna make sure that first we're taking pressure off the disc, therefore unloading it, which is gonna take pressure off the nerve. And then over time, it's gonna make the hamstrings and the glutes relax by themselves. But I will give you some strategies towards the end that's going to specifically target those, but you have to go through the first three first. So let's get to it here. Okay, so the first strategy is seated spinal decompression. This is the one that you want to start with. This is the one that gets people the most results quickly. And just to give you an understanding of what this is a spine model. So we've got the front of the spine, you've got the back of the spine. And so as we decompress the spine, we're gonna be pulling this direction. That's gonna pull this disc in, and it's gonna take pressure off these very, very sensitive nerves. Oftentimes when we have disc bulges at L4, L5, L5, S1, you're gonna feel pain that goes into your glutes. Maybe it's down in your hamstrings. In some cases, it's down into your calf or even into your toes. And so by decompressing this, what you wanna look for is that those symptoms start to come back up and towards the spine, meaning they're coming out of the foot, out of the calf, out of the hamstring, out of the glute, and towards the back. That's called centralization. That's a good sign. That means pressure is coming off. So let me show you how to do this. It's very easy. If you're sitting in a chair at your office or at home, all you're gonna do is grab the sides of the chair. If you have handles, it's gonna be even easier because it's a little bit higher. If you don't, that's okay. So keep your back nice and straight. You're gonna put your hands down and you're just gonna push up like this and just allow the weight of your backside to drop gently, and you're gonna hold that for 10 seconds. You wanna do 10 reps of 10 seconds, and each time you should feel it come higher and higher up away from the leg. Now, if this is too difficult for you or it's not working, another option that you can do is using a bar if you have one to hang from. Or if you don't have that, then you can use a table just like this. And so with this, you're gonna put your hips, the front of your hips up against the table itself, straight arms, just like you did with the chair. And you're just gonna keep a nice neutral spine, and you're gonna be pivoting on your arms and allowing your back to hang. Same thing, 10 sets, 10 seconds, looking for that pain to go from down on the leg and back up. That's tip number one. This is gonna unload the spine first before we get into the next set. So let's move on to the next one. Okay, so number two, if you're dealing with L4, L5, L5S1 disc bulge and you're having a problem sitting, then extension is your friend. When you have a disc bulge, extension is gonna be more helpful and definitely more safe than any kind of forward movement. So the next one is very simple, and I've got several options for you. The first one you're gonna need is a chair, obviously. So you're gonna be sitting in your chair, and you wanna get something that's round. So what I've got here is just a towel, and you can roll something up in the towel. So I've got just a TheraBand tool here, but you can use a can of soup. You can use anything that's round. It doesn't even have to be round. It just has to have some width to it. So you're gonna roll that up, and you're gonna put this right here. You wanna find right at the belt line, maybe just a touch higher, and then you're gonna sit up against it, just like this. Make sure it's nice and steady. And then you're just gonna put a little bit of pressure against it, and you're gonna gently push yourself back. Okay, so as we get extension, we're pushing the disc back up into where it should be, away from the nerve. So you wanna start very slow, and I've got a variety that I'm gonna show you here. So we're gonna go here, and again, we wanna do 10 sets of 10 seconds. So you're gonna push back, hold it for 10, come back gently, come back again, hold it for 10, very easy. If you don't have that, you can use a variety of things. This is just a ball. So you could put that right at the arch of the back, slightly above the belt line. So I don't know if you can see it here. And we're gonna push back, just like this, very simple. Okay, if you have a foam roller, that works as well. So we're gonna put that right here. Sitting up straight, and we're gonna push back. And if you wanna get a little fancy with it, you can use a stretchy band. So this is a pretty strong one. You're gonna wrap that around your back. If it's digging into you too much, you can actually wrap this in a towel as well. And you're gonna have it right here. You're gonna pull forward, just hold on to your knees, and then you're gonna come back this way. You can even attach something like a stick. This is just a therapy stick. We're gonna put it in between the band, just like this. Place the band where you want it, and get your hands close together. So see, the band is here, and we're gonna push this way and lean back. Again, 10 seconds. Good. And we're looking for the same thing. So we're looking for relief, obviously, and we're looking for any symptoms that are here in your legs to come back up and centralize towards the spine. That's good news. So try that before you come to the next one. So in some situations, if you have an L4, L5, L5S1 disc bulge that's very specific to one side, meaning it's bulging completely to one side, not necessarily in the middle, the first exercise may not be enough for you. So I'm gonna show you how to target specifically that one side, and it's just one key difference. It's very easy, but it's very important that you get it correctly. You're gonna get back in your chair, and then you're gonna find the side of pain. So for you, it may be, let's say it's this, this is my left side. You're gonna shift your position in your chair to where that side of your back is as close to the back of the chair as possible. So it's gonna look like this. So if this is my painful side, we're gonna twist towards that way, okay? See how the back is closer to the chair here than it is here? And then you're gonna get your tool. With this one, I'm gonna use a ball. And we're gonna put it right at the ilium that's there. So if you feel your back, there's two nodules, one here and one here. That's your sacroiliac joint, or your ilium. And you're gonna have that as close to the back of the chair as possible. And you're gonna put your tool there, and you're gonna put a good amount of pressure on it, just like that, okay? So now we're gonna do the same thing, but instead of going straight back, we're actually gonna go towards our tool, our ball, okay? So we're gonna have the pressure there, and we're gonna lean back towards it. I'll show you this direction. So we're gonna go here, okay? And we're looking for the same thing. We're looking for that centralization to come up the leg this way. So the ball works really well. If you wanna use the foam roller, you're gonna do it the exact same way. It's actually gonna go in the center, but you're gonna let your shifting in the chair do all the work. So shift towards the side of pain. You're gonna put pressure up against it, just like that. And then we're going to shift towards it. This is gonna extend against the disc bulge, which is gonna help to draw it back in, take pressure away from the nerve, and we're looking for that centralization to come up. Now, if you want to use the band option, we're going to put that back here. Same exact spot, except for this time, we're going to be pushing towards the opposite leg. So the band is here. As I'm pushing the band this way, it's drawing it tight on the opposite side. So down very low, just like that. We're going to push here, and we're going to extend against it. With this one, it can be a little bit difficult because you're trying to push to one side. And so if you have the stick, the tool, then you can do the same thing, but it's a little bit easier to get that motion. Just like that. Okay, 10 sets, 10 seconds. Now I've got two more that I want to show you, but I want you to understand that if this is working well, you want to progress to the next two. If this is not working well, then you need to stick with these, because the next two that I'm going to show you are specific muscle stretches, and it could make it worse if we're not getting that centralization effect. However, if you're finding that it's coming up your leg and it's stopping right here in the glute, the next two are going to be the next step for you. Okay, so if you're finding that you're getting that centralization, it's coming up your leg, but it's stopping in the glute, and you just can't get it to go further up and into your back or get the relief that you're looking for, it could be that it's either the glute or the piriformis muscle that's trapping the nerve, the sciatic nerve that runs through there. So if you'll take a look here, this is the spine, back of the spine, this is the hip. And so as you take a look here, this yellow piece right here, this is the sciatic nerve. It's pretty large. It's about the size of your pinky finger, and it runs right down through the back side of your lowest bone here, the sacrum. And there's a muscle here called the piriformis, and it runs through there in some cases. And if that gets locked up, it's gonna squeeze that nerve. So I'm gonna show you how to release that. I've got two different ways to show you. So the first one is gonna be in the chair itself. You're just going to cross the leg over like this, nice neutral spine. You've got one leg crossed over in a figure four. You're gonna put your forearm on the knee, and you're gonna put the other hand on the ankle. You're gonna keep the neutral spine. Now remember, this is gonna put you in a slight level of flexion. So if you're not ready for this, it could make it worse, so be very careful. And then you're gonna lean forward. Again, I have a neutral spine, so I'll show you this way. So figure four, sit up tall, and you're gonna lean gently, trying to get a straight spine towards that leg. And you'll feel it, you should feel it right here. That's a good sign. Okay, and you're gonna hold that for 30 seconds, and then you're gonna release. If you can't hold it for 30, that's okay. Start with 10, work your way up to 30. I wanna show you one more of the glute piriformis stretch options. I like this one better than the crossover leaning forward because it's gonna target the glute and the piriformis more specifically, but it is a little bit more difficult to teach, but I think you've got it just fine. So I'm gonna show you how to do it in two different views so that you understand what's going on here. And then I'll show you one tip at the end of that that's gonna supercharge this stretch. Now I want you to understand, as I've said previously, be very, very careful if you've got a disc issue stretching in this way, because we are getting into slight flexion, which can make disc issues worse. But if you can handle it, it's really gonna release that piriformis and glute, and it's gonna feel awesome for you. So all you have to do is find a table or a bench or a couch or your bed that's a good height for you, as long as you're stable. you're gonna get to where you're facing the bed or the bench, and you're gonna cross one of the legs over. So we're gonna cross over just like we did with the other one. It's a figure 4 type motion. And you're gonna translate that knee bent as far over the table as you can. Now make sure you're stabilized so you don't fall, okay? So see, this is still crossed over. I'll show you from this angle. So crossing the leg over like this, translating it forward, nice stable spine, and then you're just gonna sit back on that glute, okay? Try and keep the spine in a neutral position, and you're gonna translate the chest down towards the knee, just like this. And you'll feel a nice stretch right here. Now, if you're not feeling it too much, then you come back up to neutral, and you're gonna either turn away from it, or you can turn towards it. You'll have to find what works best for you. So let me show you from this angle. To make this even stronger, as you get down into that maximum stretch position, put your hand up under the knee like this, and you're gonna just gently pull up on the knee, and you're gonna take the knee and you're gonna push it down into your hands. So you're gonna hold that for 10 seconds. So what I'm doing is essentially taking this knee and pushing it down like that. So get into that stretch position, pull up just slightly, push down with the knee. In the stretch position, hold that for a good 5 to 10 seconds. As soon as your countdown is done, you're going to release all the tension, and you'll notice that you can go a little bit further. So it's an awesome stretch. It's one of my favorites. It's actually great to do right before you go to bed because it's gonna release all the tension on your pelvis. Now stick around, I've got one more for you that is awesome. And so for the final one, if you did well with the Piriformis, you're gonna do well with this one. This is gonna target 2 different muscles or muscle groups. One is gonna be the quad group, which is the front of the leg here. And the second one, and more importantly, is gonna be the hip flexor group, which is right here. So this actually attaches down onto your leg bone, so your femur, and it goes up and it goes back, and it actually attaches to your spine. If you sit a lot for work, you'll notice that this is gonna be incredibly tight. So if we can get this stretched out, it's gonna release a lot of tension on your low back, and it's gonna give you a whole lot of relief. Now again, I can't state enough, if you have disc issues, you need to be very, very careful with this. So use it if the others have been working for you. So let me show you exactly how to do this. Okay, so to do this stretch, you're gonna need the same table, chair, bed, whatever you were using before. You're gonna stand next to it. And so the side that you're gonna stretch is gonna be the side that's closest to the table. And so you wanna get in this nice long lunge position. I'll show you from the other side so you can see. So if I wanna stretch this side, we're gonna get up close to it, long lunge, lean forward, stable hands, stable back. We're gonna put that leg up on the table. See how the leg is fairly straight? And then we're gonna lift up, and we're gonna translate our hips forward like this. What you'll notice is that you're gonna get a stretch right here in the hip flexor group. You may even feel it down into the groin some. If you sit a lot, you're gonna definitely feel it. And so to make this even stronger, you wanna hold that for 30 seconds. To make it stronger, we're gonna come back, bend the knee, grab the foot, bring it up with you, same position, and we're pulling that leg first and then going back into that motion. What that's gonna do is it's gonna add in the quad group here to really accentuate the stretch, take a lot of tension off the pelvis. For some of you, flexibility may be an issue with that, and so some tools that you can use that's gonna help is either something like this. This is just a yoga strap. Anything that has a loop in it, like this, is gonna work. You can even use a belt. So let me show you how to do that. So you're gonna sit, and you're gonna put this around your foot, and then as you get back to the table here, you're gonna put that up on the table. This is gonna go around your shoulder on the same side. And then we're gonna get back into that position, nice and stable. Go ahead and pull that tight, just like that. Now we already have a nice stretch. And then we're gonna go and lunge into it. Now if you want, you can even go a little further if you've got the flexibility or the ability, and you're gonna push it even more. And you wanna hold that for a good 30 seconds. Now, just like we did with the Piriformis stretch, you can actually fight against it. So as you go this way, you're gonna push the leg down, but don't let go of the tension. So we go here, we go maximum stretch. You're gonna fight it by pulling just a little bit. I'm accentuating it, so don't hurt yourself. And as soon as you relax, you're gonna go a little bit further. Feels amazing. It's gonna take all that tension off of your pelvis, and it's gonna help your back feel a whole lot better. Again, be very, very careful if you do have these disc issues, because if you're not careful, this could be something that makes it worse. These strategies are designed to be safe for disc-related leg pain. If leg pain starts traveling farther down the leg, that's your signal to stop, not to push harder. Everything follows a disc first, nerve second logic, so getting pressure off the disc is the most important part. When these are used correctly, sitting becomes less painful, leg pain calms faster, and flare-ups become less frequent, putting control back in your hands. And it's your health, so you need to be in control. Now it's your turn. Tell me in the comments which move gave you the most relief. Was it the chair decompression? Was it the Piriformis stretch, the Psoas stretch, the extension? Drop a comment and let me know. Also, if you found value in this video, like it and share it so others dealing with L4, L5, or L5S1 disc-related leg pain can find practical guidance instead of guessing what to do. And remember to subscribe if you want to understand your body better, reclaim your health, and get practical steps you can use right away to move towards a life with less pain and more purpose. If you want to keep building on this, the next video to watch is this one, L4, L5 disc bulge, the 5 exercises I teach every patient for fast relief, where you can try a structured set of movements designed to support recovery beyond just sitting. Go watch this video next.